Hello, everybody. Today we're going to talk about what to do when you get a crick in your neck, because this poor chiropractor got one yesterday, which is not uncommon for me, unfortunately. Yesterday, all I did was stretch backward with both arms just like this and felt a grabbing, sharp, catching pain right here in my neck. And went, oh crap, that's gonna hurt. And this has got to be one of the most common things that we see in our office all day long. So I really wanted to talk about, and there's a lot of information, a lot of misinformation about that, about how to treat it at home and what things you can do at home to help and what would actually help. So let's talk about this today. One of the most frustrating things, this is one of the most frustrating things for people to have happen to them, because usually you didn't do anything wrong. You woke up with it, you, like I said, stretched backward and it seized up on you, you bent over, you really didn't do anything. The technical term for this is acquired torticollis. And torticollis is just a fancy name for stuck neck. So the good news is this condition is typically not a sign of anything more serious that's going on. It typically does not mean you have a disc herniation in your neck. Definitely doesn't mean you have cancer or an infection process or anything more serious that might be happening. This is usually fairly easy for us to fix for you, but hurts like a son of a gun. It hurts a lot because I can't turn, okay, I can do a little better now, but I can't turn past about right there. Yesterday it was like right here and that was it. Whereas like this side, I can go, that isn't great, but you should be able to turn your head 90 degrees. You should be able to look over your shoulder normally when your neck is not stuck. So, what causes this? When I'm talking to a patient who's dealing with this, I'm asking them some more questions about what happened the day before this happened to you? What happened the week before this happened to you? Because we can often get some clues as to the real cause of what's going on. It could have been recent travel, which is just really hard on your neck in general, with maybe sitting in airplanes or sleeping in different beds, on different pillows, things like that. It could have been a recent illness, just because you're laying around more than you're used to, which is just something different for your neck. It could be that you've been spending a lot of time looking down at your phone. That could be it with me. Just like the rest of us, we all spend way too much time on our phones. When you look down, that puts 60 pounds of pressure on your neck. So limiting time that we look down is important. Holding your phone up in front of you, if you can, is a really helpful thing. It doesn't have to be phones. It can also be books, crafting projects, your computer, of course, whatever it is. If you're looking down for long periods of time and not taking breaks and stretching and taking good care of your body, getting adjusted occasionally, you're more likely to get this. One other kind of strange risk factor for this is if you've had a fan blowing on you during the night or an air conditioner. That's another classic thing that will cause this, especially if it's not something that you typically have. So this is obviously something that more happens in the summertime. But let's say you had an air conditioner blowing on one side of your neck all night long, that can cause your muscles to go into spasm and can be a cause of this. So what should you do about it? First of all, you should see your chiropractor as soon as possible. We are definitely the first place to go with something like this, because we can actually treat the cause and get you better as fast as possible, almost always without the use of drugs or more invasive things. Unfortunately, medical providers just don't have a lot of great options for this. There are cases that we do refer for medical treatment. If it's too intense or if a person has any other warning signs, we would definitely refer them. But typically all they can give you is pain meds, muscle relaxers, steroids, which might, put a Band-Aid on it and help you feel a little bit better, but isn't getting to the cause of the problem. So when we see you the first time for this, we're going to do an examination, make sure that this is what it is, make sure there's no reason to take an x-ray, like if you fell off a horse yesterday or something like that, or that there's nothing else more serious going on. That's what we're going to do first, is examine you to be sure that this is the problem, acquired torticollis. If that is the problem, most likely what we're going to do is some very gentle adjusting the first day. Thank heavens for Dr. Nathan, because I got adjusted right away yesterday, and I got adjusted again this morning because I really needed it. It can be a little painful to get adjusted the first time when you're dealing with this, when it's really stiff. I mean, I see people who can't turn their head at all, literally. So if that's the case, we start really, really gently. We're not going to do anything your body won't allow. We're going to start with some gentle muscle work, some gentle traction, and a lot of home exercise, home care information as to how to treat this at home. So home care, the number one thing is do not put a heating pad on this. That is the problem that I see many, many people do. When you have acute pain and you're in muscle spasm, if it's something new, don't put a heating pad on it, because it's going to make it worse. It might feel better temporarily, but it's going to hurt more afterward. Ice packs are often the best thing. We carry these soft ice packs that stay soft and flexible when they're frozen, because they're so helpful for all kinds of different musculoskeletal problems. You pretty much can't go wrong putting an ice pack on something if you're not sure. But a heating pad is really, we only recommend those for things that have been there a long time, or chronic issues, when you just need to warm up. What you can do is moist heat, hot bath, hot shower. Hot shower feels really good when you're dealing with something like this. Our infrared sauna, that type of heat is okay, but no heating pad. One of the most important things to do when you're dealing with something like this is to lay down frequently, because your head, it turns out, is really heavy. You don't realize this when your neck is doing its job, and it's fine because your neck just holds your head up all day long and does its job. But when your neck is in trouble, you're just going to get really, really tired really fast. So as much as possible, laying down for 15, 20 minutes at a time in whatever position takes the pain away. Usually that's like, flat on your back or maybe on your side, in a recliner, if that's the only position that brings you relief. Those taking breaks can make a big difference, will help you get over this faster. Gentle stretching. We don't want to do much when you're in muscle spasm, but just shoulder shrugs, slow and easy, rolling the shoulders backward gently, like that still hurts a little, and that still hurts a little, but I'm getting better. Gently moving around. I don't like neck rolls. Those are not good for your neck, but just slowly in each direction is a good thing. Gentle stretching is good. People always ask me, should I take ibuprofen? Should I take Tylenol? Frankly, those really don't help much with something like this. So if they do, you could take some, but I like to keep people off of those because of the potential side effects. We carry something called Formula 303. This is a natural muscle relaxer that has magnesium, valerian root, and some other herbs that really do help to speed up issues like this, which is why we carry it, because very often folks in muscle spasm will do better taking that regularly for a few days. So that's why I love that stuff. This is usually a pretty short-term thing, so you got to be patient with your body. It is so frustrating not to be able to do things and to have to lay down occasionally, and especially for your chiropractor, it really stinks when I hurt more than my patients sometimes, and it's so frustrating for me to have to deal with these things. But we just need to know that we are human, and everybody deals with this stuff occasionally. This problem in particular is something like I started with. It's almost never the sign of anything very serious, and it's usually very easy for us to help you get over if you follow those recommendations: getting adjusted quickly, using ice, resting, gentle stretching. and moist heat in the form of hot shower, hot bath, hot tub, and things like that. So I hope that helps. Please post any questions that you have. I appreciate your thoughts for speedy healing. The reason this happens to me is because I have a history of falling off of horses. So I know that I have some discs that are slightly degenerated in the lower part of my neck. So if I get adjusted regularly and I don't look down at my phone too much and I moderate my stress level, get regular massage therapy, I do pretty well. But this does creep up on me and seize up on me, and then I know that I have not been taking good care of myself. So I hope you take good care of yourself this week. Thanks for watching. Have a great week.